Welcome back. In our lesson 8 there has been lots of talk about shared decision making, and of course when patients are cognitively impaired, but even in cases when the patient doesn't speak your language, and we mentioned that communication is such an essential part of doing advanced care planning. But now when we speak about shared decision making, who should be involved in this process, and how should this happen when patient, he or herself, cannot be part of this discussion? And it really is about where this patient wants to die, how this patient wants to die, and under what kind of circumstances.
Yeah, I mean, this is a very important issue, since we know when the disease is progressing, we have this cognitive decline very often in Parkinson's disease. And very often the patient is treated at home by the family or cared for. So, and many of the family caregivers, they have a high burden with the disease. Some of them are already really depressed or demoralized because of the treatment, and all the things are involved there. So having kind of, these discussions, at first it is important that we as a physician, communicate with the patient, but also with the relative, in what situation we think the patient is and what possibilities the patient might have. And then we really have to, ask the caregiver how she or he is seeing the patient's situation when the patient is not able to communicate with that one. So we have to bring this one together. And, based on our impression and, the history the caregiver can, provide us in these terms, we should provide a kind of decision. And we should ask whether the relative and or the patient can go along with our decision. So primarily it is very important that nurses and physicians are taking the part of the decision maker. So this does mean a lot less burden to the family and to the patient. And very often I have experienced that in an advanced stage of the disease, the view of the patient on her or his symptoms is completely different from the view of the relatives. So they don't see really what's going on, and sometimes they feel pretty fine, they feel pretty well, but they don't see the burden which is on the relative. So we really have to bring this together, and based on our impression, and this I think is a really artful doing there, we have to make a decision, and we should see whether the relative and the patient can come along with our decision.
Thank you very much.